Hi, sorry. Can I help? Plum violet. Okay. What is your name, please? And how is that spelled? Cool. Nice name. So I just need to grab a few details off you. Last time you came in, you probably already gave your details to your doctor. I just need to check that they're correct. Plus, your doctor's not quite ready to see you. She's just had a patient, so she is just getting things ready for you. Okay, cool. What's your phone number? Awesome. Email address? Cool. At hotmail.com. Okay. And the first line of your address? Yeah, it can be either the one. Do you remember the one you gave last time? No? Okay, so just give me, if you just give me the address at which you're staying at currently. At least we got something then. Is that double E? Okay. Awesome. Is this your first surgery? How old are you? Wow. I mean, I've had surgery before. Nothing cosmetic or anything to do with, I mean, nothing on my face. Yeah, I had surgery on my leg, on my knee. Yeah, that was when I was quite young though. Yeah, it's crazy. Not that you're not young. I had surgery when I was very young, like 6, 7 years old. Yeah, major. Crazy stuff. Anyway, your date of birth. That's why I'm asking, right? Nice. Okay. So your surgeon just needs to know a couple of things, and if you don't mind, I'll just go through them with you now. Obviously, you did have your pre-op consultation not that long ago, but we still need to double check things. It's always best to double check. Okay, so Are you on any medication? Okay. That can include blood thinners, or we need to know about vitamins as well. If you've been taking vitamins and for the past week, it's mainly the past week, but if you've recently stopped any medication as well, that could be important to us just for the future. Okay. How long ago did you stop that? Okay. Awesome. And do you smoke? So, how many a day? Oh, right, okay. Well, have you smoked at all today or the past week? Okay, and any allergies that we might need to know of? Allergic to quite a lot then. That's okay. Yeah, we're not gonna stop. Yeah, I mean, you, like I said, you've probably already given this information before. Okay. Are you prone to lightheadedness or fainting at all, vomiting, any of those kind of things that we might need to know of? Okay. And lastly, but not least, is there anything that you're quite afraid of about today in terms of anesthesia, being put to sleep and that kind of thing? Is there anything? Yeah. I mean, at the end of the day, that's probably the scariest part of the whole thing. You're going to be pretty much asleep for the rest of it. And then the only thing you'll have to deal with is obviously the healing process, which will all be, instructed, and you'll be instructed on like how to proceed with that and how to make it the least painful possible, which we hope to help you with as well. We have pamphlets that you can take home just at the entrance over there. And yeah, the healing process will be the most difficult for you. Obviously, you just have to sit back and relax while you're getting your surgery. Okay? Yeah, I mean, preparing for surgery is also quite difficult, although you don't have to deal with the pain of the, surgery that has been done, which you will do for the healing process. Yeah, I mean, yeah, that's definitely a plus. Okay? Alright. Let me just see if she's ready. The internet is so slow here, I'm really sorry. Here we go. Okay. So she'll be ready in 5. I'll call you when she's ready, but before then. It is the third door on the right, just through that corridor. Good luck. Hi, welcome to my office. So you met my receptionist? Lovely, yeah, okay. Well, we're just gonna have a little chat now. We're gonna talk about the healing process, and I'm just gonna check that you have done as instructed for today in terms of how you've prepared for the surgery, etc. So to start, I just want to make sure that you haven't eaten for the past 24 hours. Great, wonderful. Okay. And okay, so I was made aware that you are on a couple of medications that might include blood thinning. And I think we did talk about this last time. I just want to make sure you haven't still been taking those. Obviously, this can cause a lot of bleeding, and during the surgery we want to minimalise bleeding and anything like that, just as a precaution. Yeah, awesome, that's great. What else? So how did you get here today? Okay, so she'll be taking you back as well. Wonderful, awesome. That's really good. And obviously you knew not to put anything on your face. You're looking very clean. It's wonderful, that's what we like. Obviously you're about to have surgery. We don't want any unwanted, any bacteria in fact, to enter your skin, and yeah, hence we need a clean face, no makeup, all of that good stuff. Great. And you did also say that you do smoke, but casual smoking, social smoking, yes. None of that the past 2 weeks. Awesome. That's really good. Okay. Perfect. Right. So before we get started, I am just going to run through with you the healing process of this surgery. Oh, excuse me, I have had a long day. So obviously we've already talked about this, but I want to make it really clear to you different points of healing. It will take about 2 weeks for most of the swelling, bruising, pain to go away. Obviously you're going to be healing for I'd say the next 6 months, to be honest. For any kind of surgery it does take longer than the given healing time, as that does only really include the outer wounds and visible wounds, and most of the pain. Obviously, yeah, like I said, it won't be an easy healing process, we already discussed that. And yeah, so it is really important that you follow these instructions, because otherwise you can get a prolonged healing time, and to be honest, nobody wants that. You want, to be honest, I mean, anyone would wish for after their operation to just get back to normal life just like that. Obviously we know that that is not possible. So okay. So obviously I will give you a pamphlet on the healing process, just in case there are any details you forget, or anything that you want to look through again. Okay, so I have here some pictures of people who it has healed on them. Some of these will be in your pamphlet. Sometimes people want to just have a look at their pamphlet to remind them of what they have to come, and obviously if you take care of your healing and if you take care of your like bandages and all of that stuff, when it comes to your final result, not only will it arrive so much sooner than you expected, it will also, you'll come out with the best result, and that's really what we want for everyone. But we can't come home with you and take care of your dressings and right. So basically the main thing you need to remember is you're wanting to change you don't want to move any of the dressing. You will need to come back and get that changed after a week, and yeah, I'll take that off for you, and yeah, you'll have your new nose. So yeah, obviously no makeup is best. I understand that sometimes it is what it is, you're going out, you want to put a little bit of makeup on for a selfie. It's just best to stay away from makeup. Makeup brushes create bacteria, the makeup itself can get inside the wound and just make things worse for you, and we don't want that, do we? Okay. So obviously there's that. You really want to keep eating healthy, drinking loads of water. Obviously the body heals way better when it is hydrated. And yeah, so okay. Have you got any questions at all so far? No? Okay. So obviously I'm going to start right now by just drawing on your face. So if you just want to look up slightly for me. Okay, so right, so if you just want to look at my finger here. So I'm just gonna draw at the top of the bridge of your nose. Right. And then the centre, top of your lip. Just creating, just drawing some lines, just so that you have a gorgeous nose already. Hopefully this will, I mean, from experience, we've had so many, I do apologise, from experience I know that it will sort out your breathing. I just hope that we can optimise comfort to the best that it can be. But yeah, it is looking good. Your nose looks really easy to work on, and when I feel, see, you actually have a perfect nose to work on, so everything will be just fine. Okay, if you just want to look up for me. Okay. Excellent. Right. So now that I've drawn all over your face, no, I'm joking. Now that we've got all that sorted, yeah, I'm just going to tell you what I'm going to do while I just prepare myself. So to begin, I am just going to get my equipment on, and I'm going to sit you back in a minute. So if you just want to bear with me. So in a moment, I will sit you back and I'll give you just an injection to stop the pain, and then I'll put a cannula on your hand, in which we will insert some general anaesthetic and it will put you right to sleep, so you don't need to worry, you won't feel anything, and you will not be conscious or aware of anything that's going on anyway, so you really have nothing to worry about. If you do have any concerns right now, let me know. Is there anything that will make you feel more comfortable during the procedure? Okay, you're very welcome to listen to music. So yeah, but basically I will just be working on you now. Just right. Okay, so to begin, I'm going to ask you to count down from 20, okay? And when you get, right, when you get to number 5, I will be injecting you with a numbing agent for your nose, so that will be going in your nose, okay? Well, around your nose, okay? It's okay. Alright, if you want to count down for me. That's really good. Okay, just going to attach these monitors now. Okay. Awesome. Okay. Just going around the other side. Yeah. That's really good. Just go over. Everything's perfect. Amazing. So good. Can you pass me that? Thank you. for the stitching. Yeah. Yeah, I'm certain already. Let's do this then. Finish this up neatly. Think there we go. I think that's it for the stitching, guys. Nice. Last, definitely not the least. Let's get this. These bandages. Okay. Ready for this. Final. The dressing, and it's good.